today I wanted to talk to you a little bit about hormonal imbalances. And what does that mean? So we're talking about three main classes of hormones that we see the most in our practice. One is female sex hormones, like estrogen, progesterone, testosterone, this sort of thing. Second is stress hormones, such as cortisol, noradrenaline, adrenaline. And the third one is the thyroid. So there's lots of hormones in the body. There's actually just hundreds of different types of hormones. But what we see most commonly in terms of the everyday things that we treat, these are the three main classes. So how do you know if you have hormonal imbalances? Well, some of the common symptoms include things like weight gain, fatigue, insomnia, brain fog, headaches, obviously menstrual irregularities, menstrual cramps, PMS, this sort of thing. So there's a lot of them, but these are some of the more common things that we see. They're not necessarily caused by hormonal imbalances, but these symptoms in general are related to hormonal imbalances. So let's say you have the symptoms I just talked about. You might want to know, is this actually a hormonal imbalance? One way to do this is testing. You can test hormones. You're talking about saliva, urinary, blood testing. In conventional medicine, they're often using blood, although the saliva and the urinary testing can give us a little bit more information often. Okay, so let's say you did your hormonal testing, you found that things were off, and you're saying, oh, this is the cause of my problems. Not so fast. The question still is why? Why are the hormones imbalanced? And this is a commonly overlooked issue, even in the world of holistic medicine. Usually it's like, okay, Miss Jones, your hormones are imbalanced. We're going to give you this herb that's going to help your hormones, or we're going to potentially give you bioidentical hormones to replace those. Is that really treating the root cause? I'll ask you. Do you think? In our practice, there's three main things that we find. First is diet's not right. Two is exercise is not right. And three is the nervous system and stress response. There can be a fourth thing that involves toxins. That can sometimes affect hormones. But the three main things that affect the hormones are, again, diet, exercise, nervous system, and stress response. Of these, by far the most important is the nervous system and the stress response. The nervous system and the stress response are the primary driver of hormones. I tell my people, hormones are downstream of the nervous system. So what does this mean? The nervous system and the brain are basically like the operating system of the body. They're what run the show. So how do you treat these issues? Well, there's a couple things. One is we have specific therapies that we use that help to tone and to balance the nervous system. We also have techniques, mind-body techniques that we teach our folks to show you exactly how to train these things, how to repattern the brain. Most people are born with a certain pattern of their nervous system and their immune system. The great thing is you can change it, and you got to change that pattern, because all chronic illness is a stuck pattern. You're having chronic symptoms, something is stuck. If you want to get to the true root cause, you got to change the pattern. You got to get it unstuck. So I hope that explains a little bit about how hormones work and why you may be feeling the way that you're feeling. If you have any other questions, just give us a call at our practice. We'd love to talk with you further and get to know more about you.